we're not in the business of supply chain. We're not in the business of selling goods. We're in the business of providing healthcare. And so because of that, it does add another level of complexity and another level of just difference in the sense of the same emphasis is not paid to supply chain in a healthcare setting as it is in a, again, automobile industry, right? The automobile industry.
Welcome everyone back to this episode of Smarter Sourcing. My name is John Pavia, and today we are lucky to be joined by the Chief Supply Chain Officer of Mount Sinai Health Systems, Carlos Maceda. Carlos, thanks so much for joining us.
Thank you, John, and thank you for having me.
Absolutely. Yeah, you have a great personal story that I think I'd like to start with that, because I think the folks who listen to this program and watch this program will be really interested in the whole background, your parents coming over from Cuba and you going to Spain. But if you could, give us the Reader's Digest version of how you went from kid in New Jersey to Chief Supply Chain Officer of Mount Sinai.
Yeah, thanks for that, John. So yes, my parents left Cuba in the late 60s. They had to live in Spain for 5 years to get their visas to come to the United States. I was born there. I got here when I was 2 years old. I grew up in Union City, New Jersey. You know, it was a working class Cuban community. Mostly everybody in that community at that time was Cuban. This is before Miami was the big hotspot for Cubans. And then got out of high school, wasn't sure what I wanted to do. I went into the military, went into the Air Force, got into supply chain in the Air Force. And when I got out of the Air Force, still didn't know what I wanted to do and sent out my resume to like 100 places. Inglewood Hospital in New Jersey gave me a shot as an inventory clerk working on the dock, doing inventory, like $6 an hour. And then I just caught the bug for it and started going to school at night. Took me like 9 years to get my undergrad, then went to get my master's in Fairleigh Dickinson. That was every Saturday for 2 years, and just continued to work hard and invest in myself and use a lot of what my parents taught me of, like, you know, every time I would come home and I would tell them I'd have a bad day or something went wrong or something, they would tell me, you know, basically, as compared to leaving your family and having to relocate twice in your life, and it would be, you know, it put it in perspective what my bad days were compared to what their bad days was. And so that's always helped me keep moving in a forward direction and just working as hard as I can to make my, you know, my parents proud and to take care of my family. So
Well, what'd you do in the service? What branch?
Air Force, I was in supply chain as well. I did a year in Korea with the U-2s at Osan. And then I worked in South Carolina. I was there for 2.5 years doing F-16s with the F-16s.
And did you, when you were in the service, you said you caught the bug, but you caught the bug to be in supply chain. It sounded like in your first job out of the service.
Correct.
Right. So in the service, though, you clearly got a better sense than the average person of what supply chain even means. I crack up whenever I talk to folks like you about the pandemic, and so many people for the first time in their lives were saying, you know, when they ran out of toilet paper, what's supply chain? You know, what does it even mean? So what learnings what impact did your experience in the service have, if any, with where you are today?
You know, the interesting thing is that looking back, I owe my entire career to the Air Force. When I was a 17-year-old snot-nosed kid, I didn't really put too much attention to it. And so when I got out of the military, it was, you know, I did my time and I did my service. And so I hadn't gone to school yet. And so I just had a high school degree. And so it would be silly to apply for other types of jobs. And so I put my resume out there anywhere that would have some type of supply chain background. And so I really didn't understand all of what the Air Force was teaching me, but they were teaching me to make sure that obviously I followed up on my responsibilities, that I was respectful in who I was speaking to, understanding that you are part of a greater service. All those types of things kind of rolled into that. And, you know, definitely there are still things that I do to this day that I could attribute to the Air Force.
Do you spend any time going to talk to vets or, you know, kids who are still in the military transitioning out? Any mentoring there? Because I know you do other mentoring, but how about with the service?
No, not really. I mean, you know, I left the Air Force. I mean, you're talking now 30 years that I left the Air Force. So through our supplier diversity, we always try to look for vendor owned veterans We try to make sure that we include them in our supplier diversity program. But I hadn't thought about that actually of doing any type of mentoring. And again, it was so long ago, and it was only a one tour. Not sure that I probably am the best fit to do some of that, but hadn't thought about it.
And looking back now, and now being in a position where you manage other people, younger people coming into sourcing, procurement, supply chain management, do you think the military is a good place to recruit from? Do you guys actively do that?
A lot of the work that we do in materials, because supply chain for our healthcare is broken out into two spaces, right? And so there is the corporate side that does the procurement and contracting world, and then there's the materials world that's a lot more of the logistics warehouse type of stuff. We have our full talent recruitment department, and they actively look for all levels of diversity to try to apply. And we've actually hired a few folks from the military in the past. And so we definitely don't shy away from it. That's for sure.
So let's talk about supply chain, sourcing, procurement as it relates to a healthcare network. Because I think it's in speaking with folks who come out of, the sourcing, procurement, supply chain world, and anybody associated with a hospital network, health network, it's got an element that's different than any other walk of life in that, what you do impacts both your company at a holistic level, but then your customers at an individual level. And your customers are coming to your employer for medical reasons usually. And, there's a sort of a heightened pressure, maybe, I would think, and the sense I've gotten from others. But in your role, does that weigh on you? I mean, the decisions you're making about what to buy and what not, yeah, and it impacts the bottom line of your company. But the people, your customers, are a little different than just someone coming to buy a widget.
Sure. I mean, we emphasize that to the staff constantly. I mean, so the big thing about supply chain that a lot of folks don't understand when it comes to healthcare is that, in almost every other facet of industry, supply chain is so critical to the work that they do. And I'm not saying it's not critical in healthcare, but it's not critical at the same level of other organizations. And again, I don't want anybody to think that I'm diminishing our role in healthcare, because that's not what I'm saying. But, when you think of whether it's the car industry, whether it's retail, whether it's whatever, if your total business is based on sales of whatever it is that you're selling, if you can't sell the product because the product isn't there, that's lost sales. You can actually go under with a real bad supply chain, right? We're not in the business of supply chain. We're not in the business of selling goods. We're in the business of providing healthcare. And so because of that, it does add another level of complexity and another level of just difference, in the sense of the same emphasis is not paid to supply chain in a healthcare setting as it is in again, automobile industry, right? The automobile industry 30 years ago realized that they could take their brake pad plants and put it next to them in the same warehouse or in the same facility or right next to them, and they can cut down on their shipping costs, and they could do lean and all those things that the true supply chains do. Whereas we are more here to support and make sure that what our clinical staff needs is there when they need it for the patient that comes in. So it's a little bit different, but we put that emphasis on our staff constantly, because it's not necessarily just running out of something, because sometimes you can use other items, and docs and nurses can use other items. However, for those things that are very specific to a very specific case, I always try to relay is, imagine if that was your mother, your father, that had a case scheduled for 3 weeks in advance. They're worried for 3 weeks that they have to do this procedure. They probably can't eat for 24 hours before the procedure. They get into the hospital at 6 o'clock in the morning, and somebody tells them, we can't do this procedure because we don't have the supplies that we need for the procedure, or this implant didn't come in so we can't do the procedure. And now they got to go through all that again. Nobody would want their family member to go through that. And so we take that very, very seriously. And I carry that with me every single day.
So tell us about your organization, your specific organization, how it's structured, the number of folks that you manage, and how responsibilities are split up between direct, indirect, et cetera.
So we have it's close to 250 people that report up into supply chain. I report into the chief resource officer. And It's really broken out into, as I mentioned before, the corporate team, which is about 80 people, give or take a few people. And those folks are the contracting, the computer folks, the technical folks that make sure that all the software and everything that we use to make the day run is working well. The procurement folks, which is contracting, value analysis, sourcing, and then the purchasing folks that are placing the orders. And so those folks used to be at our corporate office at 42nd Street in the city. Since the pandemic, we've all gone virtual and everyone is remote. So that staff is remote, which adds obviously its own challenges to managing folks when they're all remote. And then you have at each of the 8 hospitals, you have folks that are on site. And then we have a couple of other sites that are not hospitals, but a little bit bigger than what we'll just call a physician office, right? These are ambulatory surgery centers. We have a very large behavioral health location in Manhattan. And so those also require certain staff to be on site. So that's about, we'll say about 150 folks, 180 folks, something like that. And so those are the folks that then are on site that have the receiving comes in every day. They put the items away, they requisition the new items, and those folks are, they're hustling all day long.
And so between those 250 people, they are sourcing everything from hospital beds to pens,
Toilet paper,
pads, every toilet
yep.
paper. And that all
Correct.
All funnels in through you.
Yes. So there's a couple of other specialties. We don't handle pharmacy, which is a very large spend, but we have a great team that handles pharmacy. We assist in the IT world, and then the construction world does their own thing. So all the goods and services that are used on the day-to-day besides pharmacy and IT is falls under us. And then the construction folks handle just the construction stuff, which obviously requires its own subject matter expertise.
That's a tremendous amount of spend that's flowing through. Even if you take out, the IT and anything else that's a specialty item.
It's over $2.5 billion.
That's amazing. That's amazing. So your job is very, very multi-focused on, and one of those things is the bottom line and how what you're doing aligns with the overall goals of the overall company.
Correct. And again, because healthcare is so complicated, and because it's not the items that I am or the team is working to reduce, is not our finished product. And so the vendors come to us and say, they have inflationary pressures, and so they want to raise their prices, but we can't pass the cost on to anybody, right? More than probably 70%. I'm probably off by a little bit, maybe the number's even higher. I haven't looked at it in a while, but a very large number of our revenue comes from government payers. And that's set to us, every October, those rates are set. So whether our costs go up by 50% or our costs go up by 10%, there's nothing that we could do to charge folks more, right? And then the rest of the payers, the rest of that mix is insurance carriers, which those are contracts that are set as well. So we can't pass on any increases to anyone, regardless of what that increase is, whether it's paper, whether it's the shipping costs, it doesn't matter.
So let me ask you this, because I know I read some of your previous interviews and some of your comments, and let's talk about leadership. And it's when you're talking about an organization like yours, really the sourcing procurement organization in any company, getting your folks aligned and trying to get them to understand and appreciate how the goals of your department need to be aligned with the overall goals of the company. How do you do that in your organization, especially now that post-pandemic, you've got people working remote and whatnot, but there's so many things that go into mentorship, leadership, management, and in learning about your background, you took a lot of leadership courses along the way, went to school at night to get your MBA after you got your undergrad degree. And I'm curious your philosophy on leadership, management, especially in an organization like yours, where you really need to do your best to keep them morale up, keep people communicating, and most of all, keep them aligned with the overall goals of the company.
John, that's a great question. I mean, I would say that my style is continuously evolving because of the things that you mentioned, right? Again, I come from a background of I remember getting laid off of one job in my life, and I called my mom, right? Kind of tail between my legs, because that never happened to me before in my life. This was quite a few years ago. And when I told her that I had gotten laid off, her response was like, well, why are you wasting time calling me? Go find another job. Right? Like, that's so when you're used to that type of, it's hard to not pass that on to your team, because not everybody's used to that.
So
I've struggled with it.
So I want to interrupt you just 1 second, because I read that part. I read that story. You said that it was part of the best, maybe the best advice you ever got in your life, because it was pick yourself up, dust yourself off, and get back in the game. Stop talking to me, from your mom.
Right.
And you said that was maybe the best advice you ever got in your life, but also it's been a curse as well, because it's very hard for you not to have that same kind of sort of like suck it up attitude when you're faced with a junior person in the organization that reports to you, and they're coming to you for some personal advice, and you're like, I'm the same way. You sort of give the advice that you think did you well. So it was interesting. I thought you said it was both the best advice you ever got, and it was also sort of a curse.
Yeah, absolutely. And I continue to tell that story so that people can kind of understand exactly that. And so I continuously try to remind myself that everybody doesn't get motivated the same way, that everybody doesn't have that grab yourself by the bootstraps mentality, and quite frankly, every situation doesn't require grab yourself by the bootstraps, right? Sometimes you do have to be a little bit more empathetic and a little bit more understanding of folks. And so I try really hard. It's hard though when you combine the things that you mentioned before, right? If we don't do our jobs, people will come into the hospital and not have what they need to in their time that they are the most vulnerable, right? So you have that. We as an organization, as many other organizations, are losing money and have lost money since the pandemic, and we haven't been able to recover completely. And so again, we can't raise our prices. So all we could do is either increase revenue or reduce costs. That's all we can do. And so I also try to relay to my team that for every couple $100,000 that we save out of that $2.5 billion that we spend, that's potentially a couple jobs that we're saving. So we not only have the responsibility of our patients, but we have the responsibility of our fellow colleagues and workers. And so when you take that very seriously and you take that home every single night, it's hard to be the guy who kind of puts your arm around someone and says, it's okay, we'll get them next time. It's not that easy to do, but I recognize that it's something that I have to be better at constantly, because again, these are human beings as well. And just because I take on that responsibility doesn't mean that they should. And I need to just to always kind of remind myself of that. So it's constantly evolving, and it's a little bit of a struggle for me, for sure.
Do you hate the remote stuff? Would you rather have everybody in the office? I do. I'd rather, like, all things being equal, I'd rather have people in the office. I think you share knowledge better. You develop more of a rapport. I think that today I have 4 kids in their 20s. I think they're missing out by not having as much time in the offices as we did.
Yeah, I could see it both ways. I mean, I like the flexibility, and I think that it does, if done right. Here's the thing: if it's done right, and you hold people to the standard that everybody's doing the right thing, then they could be even more productive. Because if you take someone out of that 9 to 5 mentality and you tell somebody, look, this is the work that has to get done today. I don't care if you do it at 2:00 in the morning. I don't care if you do it at 8:00 at night or 4:00 in the afternoon. As long as it gets done, it gets done. And if that gives them a little bit more of a motivation, and it gives them a little bit of a better feel to get it done, I'm all for it. But when somebody gets distracted and doesn't do it at any time of the day because they're off doing something else, then that's a problem. And that's the challenge, where it's really hard to measure whether we're really getting 8 hours of productivity or not, right? And so that's obviously the challenge. And as a leader, that's something that you want to be able to know. And that, I think that's been the biggest challenge for me.
You were there through the pandemic. New York City was, in the New York metropolitan area, was sort of ground zero here in the U.S. during that time. What were the major learnings for you in terms of contingency planning, resource planning, just whatever you want to share is in terms of those things that stick out as the major learnings and things that you do differently today because of what we went through?
I think one of the things that we learned for sure is that we have a very tight budget. Yes, we're losing a little bit of money, but you have to be prepared. And even if you have some monies tied up in the longer term for things that might not ever happen again, right? Because we might not ever have a pandemic like this again. But not having it and not being prepared, the amount of money that you're going to spend and the amount of angst that you're going to cause to the entire staff is not worth a couple of bucks that you might spend in doing that, right? And and I think that that's a challenge for all of us, not just Mount Sinai, but for all the systems, is when you start looking at what you're carrying still in warehouses and things of this nature today, it's 5 years later, it's very easy for someone to say, oh, we could save X amount of dollars if we get rid of all of this stuff, right? The government did some of that before the pandemic, just trying to figure out ways to cut costs. Again, not criticizing anybody, just saying that it's an easy step to do. And then I think that you also find out a lot about yourself and the staff that you're with. I mean, we had to rent out a warehouse, and we were very fortunate to have a new senior director of logistics that just came to us from industry a couple of weeks before. I mean, that's how lucky we were. He put up a warehouse within like 2 weeks. We had a warehouse that had about 40,000 square feet. Within a month, we had filled it with product. And with no systems, no WMS system, and we were taking deliveries 18 hours a day, 7 days a week, because we were getting product from, these no-name companies that we had never worked with before. And we were finding out that JFK was backed up. And so sometimes through customs, there were like 80 trucks trying to get out of customs at JFK. And so we took deliveries in at 2 or 3 o'clock in the morning. And when you look around and you see the people that are there with you at that time, you really get a sense of pride, and you really get a sense of like, wow, this is an amazing team that we have here.
So when it comes to contingency planning, trying to stay ahead of the curve, give me a sense of what are those things, those sort of major things that you're trying to stay ahead of. What are those things that you check the news before you go to bed just to see what's happening, because it could have an impact on your job, on what you're doing? What keeps you up at night?
Well, I think some of the things that we're doing from a contingency perspective, and we've propped up a 3PL warehouse with our prime distributor. And now what we do is, again, in the past, a vendor would say they're going to have a potential shortage in a potential area. We might say, okay, maybe we can write it out. Maybe we can get something else. Now we don't waste any time, because at the end of the day, anytime that these things happen, the trick to all of this is speed to purchase order. Whoever gets their orders in first is going to get the product that's there, right? And so if on a Monday we get a call and say, from a vendor, we might be short for a couple of months, by Tuesday, we're placing 2 months worth of orders worth of product. And even if we're stuck with a little bit of product, we'll use it, but we do that. And also there's quite a few more supply chain apps and rags, whatever you want to call it, that are out there that I definitely pay attention to a lot more. And so as soon as you hear that there might be a strike in the north or the east shoremen or the longmen or whatever, that like you like, wait a minute, hold on a second, and you start calling your vendors, and is there a problem? Where are you shipping from? So you definitely jump on these things a whole lot quicker than you used to. That's for sure.
Mount Sinai has been very big in supplier diversity. I think you were ranked on the top 5 in the Fair 360 ranking as companies to work with. Tell us a little bit about that and how you've been involved in that initiative.
Sure. So it is something that's extremely important to us as an organization and to me personally. What I always tell my staff when these situations come up, if we can't help our own, then I don't know who's going to help anybody. So we try to make sure that, and obviously it goes without saying, but I'll say it, quality of the product has to stay the same. The cost has to be equal to. We can't pay for more product. We can't pay for, more dollars for the products. But if we could find vendors who don't necessarily know how to connect with healthcare, because some of these products that they sell could be sold in any industry. And so we try to bring them in. We've done mentoring with some of the vendors that we work with. We've increased our supplier diversity spend by about 30%. And so we continue to work on that to continue to increase that. And so it's extremely important to us.
Tell us about the $1 Million Club. Isn't that part of the whole?
So the $1 Million Club was an idea that we had to basically try to not only encourage these vendors to want to do more with Mount Sinai, but it was also an opportunity to hopefully get some of the other stakeholders in the organization to kind of see the reward and the benefit of it and try to get them to participate with dealing with more vendors. I mean, I don't know who was more had more pride that day, was the stakeholder that purchases these items from these vendors or the vendors themselves. And so it's just it's another way of not only recognizing the vendors, but also hopefully shining a light to the organization of how important this is and how we can continue to increase that. We're all somewhat competitive in nature. And so the more we can increase that, the better. And it was a great day. I mean, we had, I apologize off the top of my head, I can't remember, but I think it was like 20 something vendors that we're now doing over $1 million with that fall within the diversity spend. And so we're hoping to increase it for next year.
Did you model this off of a program you'd seen somewhere else, or this was just an idea that you guys had internally?
No, this was just an idea we had.
It's a great idea. How about technology? How is that changing? How has it changed? How is it changing your role, your department's role? How's it going to change the industry?
Well, I mean, obviously everybody's talking about AI, right? And so healthcare supply chain, it's probably not exaggerating to say that we're probably 20 years behind almost every other industry. Just because, again, and I don't say this to criticize any healthcare organization, but if you're losing money and you only have limited resources, and there's a chief of radiology that says he needs another MRI to be able to see X amount more patients, and those patients, and that could be the revenue that can help more patients. And I come back and say, well, I need $1 million so that I can get a great system so that I could potentially save, $5-10 million without being able to truly prove that. It's really tough for an organization to say, yeah, we're going to give you $1 million to invest in that, right? I think since the pandemic, things have opened up more. We have a great relationship with our leadership. They recognize what we can do, but we're behind. And so for us, it's not even so much AI. I mean, AI is going to do wonders, but for us, it's just being able to bring big data together. I mean, when we cut over 150,000 POs, we have over 1 million lines of data, right? So trying to bring that together and just have the horsepower from a computer perspective to be able to analyze that data and how many trucks we get during the day and how many pieces we receive and doing all those things, that really is not going to save a ton of money to the hospital, but it'll make us a whole lot more efficient. And we're also, to us, not only is diversity important to us, sustainability is also very important to us. So if we could reduce the amount of trucks that we get into the city every single day, that's very helpful, not only to us, but to the community at large. So being able to just analyze that data for us is extremely important. And we're starting to get there with some of the tools that we use. But obviously the panacea is to get to a point where you can actually truly have real machine learning that will forecast and predict things for us in a much more real time, that ultimately will save us money, because, instead of buying 6, you might only need to buy 3, right? That type of thing.
So I don't want to put you on the spot in terms of politics. I want to put you on the spot in terms of being a realist, being a practitioner in this industry. So we have an election coming up. If you had an opportunity to say to the next president and the next Speaker of the House, next head of the president of the Senate, look, I spent my life in healthcare, lead purchasing person, supply chain person for Mount Sinai Health. What's one of those things that bugs you? It'd be such a simple change. You'd love to be able to tell Congress, just make this simple change and have an enormous impact on the industry. So this is not Democrat, Republican. This is being just practical.
The complexity of that question is that nothing in healthcare is simple, right? But I would say to them, healthcare is broken. The system is broken and it needs to be fixed. And there's so many different things to be able to do to fix it. Just aligning incentives. Population health was created, I don't know, maybe 8-10 years ago. It was like all the buzz. And it was trying to get healthcare out of a disease state and just treating disease to prevention, right? That's really the ultimate goal. So if you could say, we're going to take the healthcare system and we're going to move it to a system that we're going to try to prevent diseases. And we're going to include, that's going to include education, that's going to include nutrition, that's going to include everything that goes along with it. And if you follow that model, all the other broken things that healthcare has, as in billing components, people getting bills from 6 different people because they all don't work for the same system and all those things. But if everybody gets aligned and say, we're going to work towards a system of prevention as opposed to just fixing the disease, or curing, not even curing the disease, but just kind of maintaining the disease, but we're going to go to prevention, then I think from there, everything can get fixed. And so that's what I would tell whoever it is.
I want to finish on maybe an interesting note, because as we sit here, it's August 1st, 2024, and there's just been announced this prisoner swap that we're doing with Russia. Without going into much detail, I know your parents have an interesting story coming out of Cuba. First of all, have you been to Cuba?
I did. I went in 2019. I still have aunts, uncles, and cousins there.
So this story that just broke a couple minutes ago, does that particular interest to you beyond just the average person, the average curiosity?
Well, I mean, listen, all of those stories do, but I mean, I'm glad to see that the Wall Street Journal reporter got released. If that's the same story you're talking about, right? Him, and then it looked like it was a multi-country swap type of thing, which is great that they were able to get out. You know, listen, communism, authoritarian governments. I mean, we live in the best country for a reason, right? And it's not perfect, and it definitely has a lot of flaws, and it has a lot of issues. And sometimes, you know, it's not easy to be the rah-rah guy for the country, because sometimes sometimes there's things that we disagree with. However, still the best country in the world just because of all of those things. I mean, you could even point to the elections in Venezuela and what happened there, right? And Chavez and Maduro were buddies with the Castro regime until Castro passed away. And so all of those things are important to us, and we always look at it from afar. And it's wonderful that there are something, I think I read it was something like the number is either 5 or 20 million Venezuelans that have come to this country that have left because of what was going on. And then the fact that they've had that opportunity to come here and to start a life all over again and to continue to add to this country is an amazing thing.
What was it like to go back to Cuba? And did you have family there that you'd never met before?
Cuba was always really weird about trying to get to Cuba. I mean, for many, many years, it was locked down and you couldn't go, right? And it wasn't until Obama that kind of really opened it up. And so I was able to go then. It was great to see them, but it was also heartbreaking to see, 4 people living in one room and the poverty that they live in and the situations that they have. And it's just really hard. And it really puts things in perspective for you, being in a country of such riches here and seeing how other parts of the world live and how it's not easy. And, I still talk to my cousins rather frequently, and she'll tell me that there's days where they got 14 hours of no electricity. And so that's 5 years moving forward. That's even worse than when we were there. But yeah, I mean, it's a really bad situation.
Well, listen, you embody the great American story. You really don't. I don't say that to patronize you. I mean it. I mean, the story that you tell, your parents getting out of Cuba, going to Spain first, then here, and now being the chief supply chain officer for an organization like Mount Sinai. It is the great American story. So I can't thank you enough for joining us. I really enjoyed this, and best of luck to you, everything that you do there.
Thank you, John. I really appreciate it. And you know what? I got to say, kudos to you. I mean, you did your homework, and obviously, you're not interviewing a politician, you're not interviewing someone famous. And so to dig in deep into the archives to find that stuff just shows how serious you take your work. And so, I'm very impressed, and kudos to you. Thank you.
Talking about supply chain, for some people, it's going to be the most interesting thing in the world. For most people, you got to make it personal about the person that you're talking to. I mean, their personal story. Everybody I've spoken to has an amazing personal story. And so, you may top the list when you get back, again, going back to your parents getting out of Cuba and the whole thing, and you go to night school, getting your MBA. But thank you for that. And I look forward to our next conversation.
Thank you, John.
To all of our listeners and viewers, thanks for joining us. Again, this is John Pavia, Smarter Sourcing, and we'll see you on the next episode.